It's my great pleasure to introduce Ajarat Bada from Nigeria. Ajarat is a trained nurse and she's currently completing her postgraduate degree in Los Angeles at the University School of Public Health. She has done some amazing things. She's been working for the US Doctors for Africa, but she told me out the back there that she organized the inaugural healthcare summit for African First Ladies. So she's learned very early how to achieve political influence and the really important role of women leaders in achieving change in healthcare. She's actually applying to go into medicine here in the UK, which I think we all wish her the greatest of luck, but she's got some really interesting things to tell us. Ajarat, welcome.
Good afternoon, everybody. Distinguished ladies and gentlemen, councillors and fellow delegates. It's definitely a pleasure to actually be here today and address you on this very important panel. I gave a great deal of thought about the fundamental purpose of our gathering here today, and I have concluded that at the heart of this gathering is a duty. A duty entails a right. A right is that which we owe other people, and in turn, they owe us. I'd like to use this opportunity to contemplate the duties we have to our fellow human beings. Like Ms. Robertson said earlier, and I was just going to mention the Universal Declaration of Human Rights, particularly Article 25, that speaks to our resolution. Everyone has a right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, medical care, and necessary social services. In the opening statement of that declaration, it urges every individual and every organ of society, keeping this declaration constantly in mind, to strive by teaching and education to promote respect for these rights and freedoms, and by progressive measures, national and international, to secure the universal and effective recognition and observance. When we teach and educate, we inform people. The duty of providing access and information regarding good healthcare and nutrition is vital. The absence constitutes a violation of the Universal Declaration of Human Rights. Not providing information and access to basic healthcare challenges the very essence of the document and the fundamentals of an egalitarian society. If you ask the economists, the bourgeoisie, they'll tell you something else about an egalitarian society. But in healthcare, we define egalitarian society as a society that is free of health disparities and health inequities. So pretty much the same health care that's guaranteed for the president of a country should be guaranteed for the lowest citizen, if we can even define who a lowest citizen is. So I'm going to bring you fast forward a little bit from that December meeting in 1948 when the declaration was actually made to the September 2000 gathering, the largest gathering of world health leaders when the Millennium Developmental Goals were actually formulated. And as Ms. Robertson alluded earlier, the ones that are directly related to us are going to be goals number 1, part of it, which is to eradicate poverty and hunger. Hunger is related to malnutrition. Goal number 4, which is to reduce infant mortality. Goal number 5, to improve maternal health. And goal number 6, to reduce HIV/AIDS, malaria, and other diseases. So I'm going to pretty much tell you where we are right now concerning those Millennium Goals, what has been done, and what you all can do. Goal number 1, eradicating poverty and hunger. Does anybody remember the Pulitzer Prize picture of Dr. Carter, Kevin Carter, 1993, a journalist? It's a picture of a little kid, a little malnourished kid who was crawling towards a food center in a farming in Sudan. Behind this kid is a picture of a vulture. A vulture's waiting for the kid to die so that it can feed on it. Even the Creator did not fashion it that way. We cannot be food for animals. What has been done about malnutrition so far? Everybody knows Dr. André Brand. He's a French pediatrician who actually formulated something called plumpy nut, if you're familiar. His inspiration was Nutella spread. Many of you eat that with your sandwiches or whatnot. And the inspiration was actually to make a peanut-based formula that is fortified with nutrients like vitamins, minerals, or whatnot. And this is shown to reduce malnutrition by 50%. Plumping out is used in Nigeria, in Mali, different parts of sub-Saharan Africa, where malnutrition is robbing us of great minds of tomorrow. What can you do about it? What can you do about malnutrition? I urge everybody to actually support local farmers. If you support local farmers, they can produce food, so we're not necessarily dependent on buying food that is grown outside our country. So if you support local farmers, for example, if you support the rice farmers in your country, rice is food for 50% of the world's population. 70% of us depend on the income from rice farming to actually live and survive in this society. So if we actually support local farmers, for example, rice farmers and agriculture, we can move a step further towards reducing malnutrition. Goal number 4, reduce childhood mortality. How bad is it? Millions of children are dying yearly from diseases like measles and polio. A couple years ago, we all, the world looked smallpox in the face and kicked it and said goodbye. My mom told me kicked is not necessarily a good word, so we kissed it goodbye forever. Smallpox is history. I beg your pardon, smallpox is history. We can do the same for polio. Polio was almost history until it showed up in a little village in India and in some parts of Nigeria and 2 other countries. We can do the same thing that we've done to smallpox, to polio, measles, and other diseases that are going on right now. So what can you do in your society? There's a model that I want you guys to think about. It's a model that is being used in some Hispanic populations in the United States. It's called Promotor de Salud. My Spanish friends, please forgive me. But what it means in essence is they're healthcare promoters. These are local people, lay people in the community who actually get basic healthcare training. They're not nurses, they're not doctors, they're nothing. They're just ordinary people like you and I who get basic training and they're able to actually affect change in their communities. This is similar to like barangay health workers in the Philippines who are just lay people who learn about things and they're able to teach and go to the communities and say, this is the importance of getting vaccination, of good nutrition. It's very important, if you send a white-collar doctor to a little village, that's really great. But if you can't really communicate with the community, we can't really get as far as we want to. So go back home and promote training lay people to relay healthcare information. Goal number 5, improving maternal health. The pictures painted of thousands of women die yearly during childbirth in sub-Saharan Africa, whether because there's no healthcare facilities or there's no access to maternal care. What has been done about this? Anybody hear of mama kits? Mama kits are little kits that contains everything that a woman needs to deliver herself of her baby. So this mama kit is just a little pouch, has everything inside of it. You can actually take it to the bedside, to the woman's house, and deliver of her baby there. It's used in Nigeria, and we've been able to reduce maternal mortality by a significant percentage. If we can encourage innovations like this would be really great. So what can you do in your community? I'm going to borrow something from Professor Eunice, if you don't mind me, microfinance with women, where women come together and everybody's borrowing money and borrowing money for the benefit of everybody. That means if somebody doesn't pay, the other person is responsible for it. We can borrow this model for improving maternal health. We can have a woman who's responsible for a group of women, women of reproductive age. So when they're pregnant, this older woman encourages them to go to their antenatal care services, to get the immunizations or whatnot that they need for their babies, and pretty much a support system of women together. This is what we can actually do. Goal number 6, reducing HIV, AIDS, and malaria. HIV, AIDS, and malaria, and I'm going to let the other speakers actually touch upon it. It's a big topic. We don't need statistics. It's a really horrible disease that's killing a lot of people. What has been done about it? I'll just bring you guys to the example that's used in the United States, the PEPFAR, the President's Emergency Plan for AIDS Relief. We don't have enough time to discuss the success of PEPFAR or whatnot, what's going on, but this is a model that other nations can actually adopt to providing, antiretroviral medications to everybody that has HIV/AIDS. And I just wanted to ask the pharmaceutical companies a little question here, if anybody's here from them. If we are carrying clinical trials out in Africa and making these antiretroviral medications, why can we not make it a priority to provide antiretroviral medications to every single person in Africa that suffers from HIV/AIDS? That's the question I'm asking the pharmaceutical companies. What can we do about it? Pretty much what we could do about it is to lobby, talk to somebody about you, write petitions, lobby the pharmaceutical companies. We all know that it costs $1 million, millions of dollars to produce the first drug, but subsequent pills cost cents on the dollar, pence on the pound. we can provide antiretroviral medication to everybody who needs it. In closing, I just wanted to give you a few statistics. Yesterday, 16,000 children died from hunger, 3,000 from malaria, 1,000 from HIV/AIDS. Today, 16,000 children will die from hunger, 3,000 from malaria, and 1,000 more from HIV/AIDS. Tomorrow's numbers are in your hands. What are you going to do? I know we're striving hard, we're working real hard to make, to meet the Millennium Developmental Goals. But if one more kid has to go hungry, one more kid has to die from polio, we're not doing our best. We can do better. And I'll leave you with a quote from a very wise man. He said, if there's something bad that's going on around you, you stop it with your hands. If you can't, you speak up against it. And if you can, you feel bad about it in your heart. And that is the weakest form. But there's wisdom in what he said. Because if you feel bad about it in your heart, you will speak up against it eventually, and you will do something. If you're not the one who's going to start doing something right now, or speaking right now, feel bad about it. Tomorrow, you speak up against it like you will speak up against it like we all are doing here, and eventually, you will do something about it. Let's do something, people, please. Thank you all.